We're joined now by health activist George Jobe, who's the Executive Director for the Malawi Health Equity Network. He speaks to us from Lilongwe in Malawi. Very good evening to you. Thank you so much for speaking to us, George. Let's just first start with how bad the situation is and what your organization has been able to find out about the latest outbreak.
We have been following the disease because firstly, when it was registered, it was in one of our districts called in Sanje, which borders with Mozambique, and there was cross-border movement of people. Then we found that the cases went up to Blantyre and the other districts. Later on, it has gone to the northern region, and we have registered cases throughout the country. It is very worrisome that the cases started coming out towards the end of the rainy season, and we have had cases throughout the dry season, and now we are going into the rainy season. There was a time when the vaccine, cholera vaccine, came and was administered in 8 districts. But we delayed to have the second dose because of shortage of the same. Just about 2 weeks ago, we have received some vaccines that are going to be administered, not as a second vaccine to the first cohort, but to the new districts where we are having cases. As Malawi Health Equity Network, we have been advocating for a number of interventions. The issue of availability of vaccines, whereby even the international community must come in to assist, and the collaboration of different ministries. For the first time in Malawi, we now have Ministry of Water and Sanitation, and then we have been calling upon that ministry and the Minister of Health to collaborate so that the Minister of Water and Sanitation should identify communities that do not have reliable sources of water, and the Minister of Health must go there to distribute chlorine. We have also been asking another ministry where we have community development assistants to go to communities and ensure that every household is using and has a pit latrine. So these are some of the interventions, and upon our movement to some of the districts, we hear that they are failing to create the pattern, because most times when you have a case, a cholera case, the whole community, either there would be another cholera case or there would be some contacts that are established. But when we went to one of the districts in the northern region, we were told that sometimes they have had cases with no history of any movements. Therefore, we have been calling upon government to still do some research and establish some patterns.
Okay.
Now that the vaccine has come...
George, let me just jump in there and stop you, because I'd like to ask a question, particularly around civic education. I see the Health Ministry is saying that quite a lot of the cases that have resulted in fatalities is because the people are coming at a very advanced stage of the disease. So I see that the outbreak is not just limited to rural areas, but also urban areas. Do people know what symptoms to look out for so that they know to seek treatment, that they don't just confuse it with ordinary, sickness such as diarrhea, or just throwing up and thinking that it's a one-time thing or something that'll occur on just that day?
It seems that not all people know well about cholera, because we have had deaths that have happened in the communities. And there has also been some cases where people have gone to health facilities late, which means that sometimes people have thought it is ordinary diarrhea when it is cholera. And we need a lot of awareness raising or health education, which should go beyond use of the media, but should also use community leaders, religious leaders, and other leaders at different levels. The other thing is, people who are in town, like Blantyre, should not think that cholera is only for the poor or for those in rural areas. Those are some of the issues that still need a lot of awareness raising.
We also understand that this has put a great deal of pressure on the already fragile health system. What challenges are there in treating people? As you say, it's important to do research, understand the trends so that the source of the outbreak is also identified.
Of course, we can say that our community health care workers, we call them health surveillance assistants, have tried to do a lot of surveillance, case following, but with the awkward occurrence of the disease we have just established, it is giving a lot of pressure on the health care workers, and also distribute chlorine. But here we have a community where you have only one case and another case comes out in another community. That is where also we need chlorine to be distributed almost everywhere. Everyone must get chlorine. But do we have enough chlorine for everyone? The answer would definitely be no. And we have been saying amidst that constraint, there should also be awareness raising or orientation on how should people boil their water so that in the absence of chlorine, the water is still safe. But it is not only water. We should know that every household needs also to have a filter latrine, and the cholera being a public disease, every person must have the responsibility to check what is happening with their neighbor. Because if your neighbor does not have a reliable filter latrine or toilet, still house flies can come to you and affect you. It could not necessarily signify that those who are suffering are not hygienic, but the whole neighborhood must be safe. And now with the rainy season, people must be careful in the way they use water. And that requires everyone to have that responsibility, including the community leaders. But honestly, there's the pressure on the health sector. We know we are just coming out of the COVID-19, which also exerted pressure on the workforce in the health sector.
Just a final question. Is there a way that your neighbors, as in your regional neighbors, can help without necessarily waiting for the WHO to come to your aid?
The neighbors, you mean neighboring countries?
Yes.
Or neighbors of our households?
Neighboring country.
It depends on how they are looking at the disease, because at some point, we don't know as of now, but we heard that when some cases were coming from Mozambique, it seemed that at that time Mozambique had not yet confirmed that it was cholera. So there's need for coordination, and together they should accept that here is cholera and fight the disease together. We should know that Malawi has porous borders with most of its neighbors. People can easily walk around, even sometimes without using the formal border posts. So in that case, would indeed need the international community like the World Health Organization to intervene to ensure that all the countries that are neighboring Malawi are fighting the disease together.